Hey, Dr. Brian McKay, Core Health and Darien. Today, you got knee pain. We're going to be talking to you about synovial fluid. Now, what exactly is synovial fluid? It's the thick liquid that lubricates your joints and help them keep moving smoothly. Now, what happens as we age, we produce less synovial fluid. Not a good thing if you suffer from knee pain. So, we're going to kind of focus today's podcast. I hope you find these things very interesting because for me, I love this stuff. It's exciting for me to learn and to actually to teach people about it. But let's go over why exercise is really, really important. Besides, it makes you feel good, which is, I don't know, it's one of the best things about exercise I can find. Um, every part of your body needs a healthy blood flow. So exercise increases blood flow and encourages better circulation throughout the whole body. So when you have a weak or pain joint, uh, exercise can be painful, but the synovial membrane, which is the covering around the joint, it receives more of the oxygen and nutrients it needs when you do increase blood flow through exercise. So what you want to do is you really want to focus on building muscles around the joints. So like if you're having knee pain, squats are a wonderful thing. Now, if you're older, and I'm 59, so I guess I consider myself older. You can even just get up from a chair. You don't have to go to the gym to work these joints. It's a very helpful way to stimulate the production of synovial fluid. And if you do it fast enough, if you're able to, um, you're gonna create more synovial fluid, which then acts as a cushion. People think of exercise as a way to bulk up and get big biceps, pecs, basically look good in a bathing suit. I don't know about you, but I'm past that stage. I'd like to think I could get back to it, but the reality is it's probably not. But there's really, especially for arthritis. Now, arthritis is when you have wearing away the joint, and that joint becomes painful and arthritic, but becomes pocked, so the surface isn't smooth. So when you rub, the bone against the meniscus, which is the disc that separates the shin bone from the thigh bone, and what happens is exercise. You want to also exercise the ligaments and the tendons. When these components are strong, they can cushion and help support the joints more effectively, and hopefully reduce your knee pain. So the exercise, joint pain is reduced during and after exercise because the physical activity boosts the circulation of synovial fluid, which is used to help lubricate the joints. So the exercise moves these water molecules around inside the joint and helps bring, again, oxygen and nutrients to the joint without blockages. So the exercise also is going to increase your range of motion. If it hurts to get out of a chair, people don't get out of the chair, but it's kind of the opposite way to think. If you really focus on doing more exercise, like say cycling is very good. Or I actually find the elliptical to be a real nice smooth thing for your joints. Very, very smooth, very, very helpful as well too. So keep that in mind when you have that knee pain. That there are things you can do. Now, another real big benefit with exercise as far as knee pain is that it helps remove cellular waste through biological processes. Damaged cells in the joints that no longer help in the body can be eliminated with regular exercise and reduce pain over time. What happens is, I use this term a lot. You wouldn't keep garbage in your kitchen. Well, you don't want to keep garbage in your joints or in your body. So the exercise helps to remove the toxins. So that's a pretty powerful argument on why, if you have knee pain, you should be exercising. Quite frankly, right now, I can't really tell you all the exercises to do, but if I educate you to the point that you get the ideas. If you have knee pain, listen, non-steroidals, they'll help get you out of pain, but the key would be to start to exercise so you don't have the pain. And quite often, some rheumatoid arthritis, it's not going to make a difference, but for the most part, you're going to have much better quality of life if you exercise. So just want you to think about the synovial fluids, that thick liquid that lubricates your joints and keep them moving smoothly. It's in all your joints of the body. I mean, all the joints of the body. So it's not just one particular joint. Anywhere two bones come together, you're going to have it. And you have it in your knees, your shoulders, your hips, your hands. It's all over the place. Now, some conditions like arthritis, gout, or rheumatoid can change how your synovial fluid, feels. And, sometimes you have to have the synovial fluid removed and analyzed to see if you have all this stuff. But you look for pain, redness, swelling, and fluid buildup. But there, like I said, lupus is another one, a bad condition that really is going to create painful joints, and the knee joint supports a lot of weight, and over a period of time, osteoarthritis develops. We get older, um, it hurts to get up and walk, and so it's really if the basic osteoarthritis, degenerative joint disease, is fairly common, and we can help that. I think you really can see you know, a big improvement in quality of life. So the membrane of the synovial joints is called the synovial membrane, and it secretes synovial fluid into the joint cavity. Um, it's basically certain blood cells and proteins produced within the joint help produce it. So as you get older, we make less synovial fluid. Not a good thing. How do we get around that? Well, basically, the way we treat knee pain here is, all different types of knee pain. We do have some gout patients. I'd like to use laser on gout to get that pain out of the way. Rheumatoid arthritis, we treat very similar. We have a thing called a neon track solution. And the neon track solution is a way to stimulate the production of synovial fluid. That is really, really important. There's a cells called synoviocytes, and there's two different types. There's type A synoviocyte, there's type B. One is the one to take out the garbage in the cell, the metabolic waste I just talked about, and the other one is type B. It's called a fibroblast, and that's where the synovial fluid is produced with the fibroblast type B synoviocytes. Hopefully, I'm not losing you on that stuff. You got to think of it again. It's a lubricant. You don't run your car without oil. You can't run your knees without pain. If you have, you can't have without pain. You have enough synovial fluid typically. Another thing that we do is we use a specialized treatment called the matrix, which stimulates the fibroblast B synoviocyte, but also stimulates the cartilage cells in the meniscus. The blastic activity means you're producing increased production. So the matrix treatment combined with the neon track solution, which is a traction unit that stimulates production of synovial fluid, the matrix produces a change in the charge on the cell to allow for better intramembrane transport of the garbage out and the good stuff in, to hopefully ramp up the production of synovial fluid. So you can produce synovial fluid naturally. People are relying on hyaluronic acid is one of the main components of synovial fluid, and that is there's a synthetic. They make it somewhat out of rooster cartilage, and they inject that into the knees. Unfortunately, I think majority of the time, you're lucky if it works 40% of the time. But hey, listen, you're going on a long trip and you're going to be hiking the Acropolis. Well, you give it a try. I mean, if I'm not opposed to giving things a try. I'm just saying, unfortunately, I just got off the phone with a patient who asked me about the knee treatment that we do here and opted for the knee injections. He did the knee injections that didn't really work. So he'll be back in here tomorrow. And, we don't get everybody better at what we do, but can we add to the quality of life? Definitely. Can we stave off surgery? Definitely. I think what we do is it's a lot less invasive. If you have a tear in there, sometimes the tear is going to need to be surgically repaired. The anterior cruciate ligament and the posterior cruciate ligament form an X from the front, to the knee to anchor the shin bone and the leg bone in together. I'm sorry, the leg bone and the thigh bones together. And if you have a tear there, some people, the anterior cruciate is much more painful than the posterior cruciate. So we can do those exercises. If you can go to the gym, squats are phenomenal. They're really, really phenomenal. It does lubricate. Actually, since I am a chiropractor, they also make a big difference in the back. You get the back stretched and you get the fluid circulating. Overall, like I said, this stuff can be helped. Is it's something you should really consider doing, because I mean, let's face it, a lot of people got knee problems, an awful lot. So you also can your diet can also be a way to first of all increase the fluid in the synovial fluid in your knees. I mean, certain foods that are high in antioxidants help reduce the rate of cartilage breakdown. That's the meniscus. That's that cushion between the bones that a lot of times you see. If you hear somebody refer to, they got bone on bone. Well, that's more of a issue with the meniscus and cartilage breakdown. Oily fish, the anti-inflammatory properties of omega-3 fatty acids contained in fish, and you can supplement with omega-3s. Chondroitin is another thing people take for knees and do pretty well with. Avocados, high in antioxidants, and will help with reduce the rate of cartilage breakdown. You got turmeric, extra virgin olive oil, onions and garlic, berries, grapefruit, green tea. These are all things that you can do yourself to prevent knee pain. So I know knee pain is kind of unless you're having it, it's not the most exciting topic. I'm Dr. Brian McKay of Core Health of Darien. If you have any questions about knee pain, even if you don't live in the area, my number is 203-656-3636. 203-656-3636. Give me a call. I mean, I'm more than happy. If you go to my website, it's DarienChiropractic.com. You'll see a section on knee pain. And we do talk a lot about knees because we're helping quite a lot of people here get knee pain. I know it's not a typical thing you'd go to a chiropractor for, but on the chiropractic side, our solution for knee pain is pretty all-encompassing. And the believe it or not, a lot of times the femur, that's the bone, your thigh bone basically, that is misaligned. If we can reduce the tension on the knee that way, that also helps take some of the tension out, so it allows you to produce more synovial fluid. I hope you've learned a lot about synovial fluid and its importance in keeping your knees pain-free. Listen, thanks for listening. I hope you're learning a lot. Bye now.